Sorry. And so there's the litigation. People's lives are in your hand, and so you got to be really careful. You got to know what you're doing. You must be certified and licensed to do patient care. There's no two ways about it. Some people will say, "Oh, well, I shadowed this doctor and he let me do certain things." That's great. They're putting their license on the line, and if they're okay with that, then that's up to them. And understanding your scope of practice and not crossing it. And basically, that means that if you are a EMT, you're not allowed to put in chest tubes. And if you decide to put a chest tube, you can be charged with a felony and go to jail. And so there's a saying, it's stay in your lane, and this is very true. So if you're even certified to do certain things, you have to stay within that scope. You can't do anything more. I love it that some movies that you see that, oh, somebody's is an EMT but is doing a thoracotomy in on a plane. Um, there's a thing called the Good Samaritan Act, where basically, let's say you're on a plane and somebody has a heart attack and you're CPR certified or you are an EMT, you are covered, and you can't be sued for doing what your standard of care is or what your training was. But if you decide to crack the person's chest, you're kind of on your own on that. So um, there's legal issues in healthcare as well, and so that's why it's so hard to get into facilities. There is privacy rights for patients. You can't let anybody in a hospital or healthcare without any clearance. Background checks, making sure that they're not some person that's deviant or is in there for malicious reasons or has a criminal record, and also health clearance. You got to make sure that they don't have TB, COVID, or any other things. HIPAA is called the Health Information Patient Privacy Act, which is Health Insurance um, Portability and Protection Act, which is basically a law that passed in the 90s that makes facilities and individuals liable for patients' privacy. And you could get up to 5 years of jail and $250,000 fine. You could read all about what happens in some previous cases for nurses and people that were prosecuted under that law. When you read these things, it kind of scares you a little bit, but ultimately, a facility is more liable than an individual. But if, let's say, I mean, one of the examples was Michael Jackson coming to the hospital and people accessing his medical records and telling it to TMZ. I mean, that's like the extreme case, but simple things like talking about a patient in the hallway or things like that. Patient safeties. People who touch patients are trained and qualified, meaning you've taken a certain course for a certain period of time, and that you've been tested and that you are qualified to do it. And basically, and this is some sort of like state test or national test that you have to take. And then I'm basically, is this patient safe by doing what you're doing to them? And so, and then the other part of it too is are volunteers safe? I mean, if you're, let's say you walk into to volunteer or shadow, in an emergency room or in a hospital, what if you get stuck by a needle? What if light falls on your head? Who covers it? And if you get hurt, And so, and basically, volunteers have to be defended and protected and also safe. And so that's why there's all of these rules and regulations. So this is kind of the paid, unpaid for medical school that I kind of wanted to touch about, either patient care or clinical experience. If you're paid, you are responsible and liable. That means that you have a liability that in you, that you're account accountable to someone above you. You're certified or licensed. You are a professional. You're treated as such. You're in a professional setting and you are a professional. People depend on you. Your boss depends on you to show up. And also, if you make mistakes, you can be fired. So there is a part of it. Unpaid, you have flexibility and they basically have to adhere to your schedule. So, like, let's say, hey, I'm going to volunteer for this organization, but they absolutely want you to come in Mondays from 8 to 6, Mondays and Mondays from 8 to 6. They can't really force you to do that. Your job, absolutely. You have freedom to take time off. Like, let's say, hey, you know what? I'm gonna have finals for the next 6 weeks, and I'm gonna get a lot out. Fine, nobody's gonna show you the job. It is low stress and responsibility. You're really not responsible for much, and so you know, um, and so basically, you kind of just do as you choose within certain guidelines, of course, not like you're going to walk up there and say, "Hey, I'm volunteering today in the operating room and I'm going to do brain surgery." Obviously, nobody's going to let you do that. And you can be choosy, you don't have to do certain things or be in certain areas. There's pros, paid for pros and cons, and I kind of made them into a chart. You're making money, and now because of COVID and everything else, you make pretty good money. And let's say if you have to work, you have to work. I mean, if you're fortunate not to work, God bless you. Thank you, parents or your benefactors. But if you have to work a job that pays you $15 an hour versus $30 an hour, I mean, that's a pretty good thing. You have shown responsibility. So if you were getting paid for some sort of clinical experience, it says that you're a responsible person. Not that as an unpaid person you're not, but you have gone through some sort of selection process, and you're taking care of people and making money from this. And so it shows that you have this. This is the pro part of it. The con part of it is you have to get certified, so that's going to take additional time and some money to get certification. You have to go through some training and orientation. So once you go through a selection process, you have to apply, you have to be interviewed, going through training process. And again, going through interviews is not a bad thing for medical school, but it is, and you have to spend that time. Gladly, for training and orientation at your job, you get paid. So every hospital that you work for, they make you go sit through 2 days of orientation, and now thank God it's done online, so you can do it at home and get paid. You have to answer to a boss, so that you have somebody over you that you have to answer to. Your boss doesn't care about your OChem exam, and that's true in certain places. Some bosses are really nice and supportive, some people are not. So again, their job is to run a department or hospital or clinic, and they're not really gonna be very flexible on that. You must deal with rules and policies. I don't know if anybody's on social media now, but a lot of nurses and hospital workers are joking about CDC says you don't need to do certain things, but you can't drink coffee at work or whatever. And so there's a lot of rules and policies, and they change all the time. And it's mandatory work. You have to do certain things, and part of your jobs in healthcare is you have to deal with patients that have COVID, or have Ebola, or have MRSA or TB, or a host of other very contagious, and you have to deal with combative patients. And that's and these are not people that are combative on purpose. For example, if you have a closed head injury, you're altered and you're not know. So what your automatic thing is, you fight and you flight, and so it's not somebody that maliciously is trying to be combative. It's just that they're altered, and that's their state they're in. Unpaid, there's pros and cons for unpaid. The pros of it is can be flexible to your other jobs. So if you're working at Starbucks or tutoring, can be flexible. You don't have a pressure or responsibility for it, and that's again not true in all cases. You can't get fired. You could be removed and asked not to come back, but you're not fired. You don't have to do things you're not comfortable with or you don't want to do. So if they say, Trinity, I want you to go on the third story floor and jump down and see, if our perimeter is, you don't have to do it. Um, you can take time off for your OCAM exam or any other exams, and you still can't be around doctors and patients through other, ways. Con of it is no one's going to give you full patient care responsibility. Again, these are all the legal issues that exist. You're not really you're counted on, but you're not dependent on like you are not fully responsible, and you can't be part of a tribe, which I guess there's plus and and again, these are my opinions, so you may think that you don't agree with it. So this is a myth. I've asked this to almost every director or dean of admission, and there's this myth that schools only want you to volunteer experience, which is not true. Unless you're wealthy, you have to pay bills, housing, food, and transportation. So, you know, if you could kill two birds with one stone, then go for it. Patient care experience requires you to be certified and licensed and that you're accountable. You're getting paid. That means an institution has put faith and responsibility in you to provide direct patient care. You have a boss and institution that you're responsible to. You went through a selection process and you were the best candidate hired. You have gone through orientation to learn about rules and regulations. You are dependable. You show up on time, can follow rules, work in team atmosphere, and in good order to keep your job, basically. So those are all good things that in order to keep a job, just not because having a job better, but keeping it. Since a lot of people need to work, that's a reality of most of us. We have to work, and why not work in healthcare and actually do that? Unless, you have this another high paying gig like programming or working for Google or something like that, then things you should know about healthcare settings. Today, this is what's going on today, but this is in general. With COVID, healthcare workers are overburdened and don't have time for shenanigans, even though you can't volunteer. So if you get a chance of going in somewhere, just know that they're overtaxed and kind of on the edge. It's not about you. So if you are either volunteering, shadowing, or even working, it's not about you. It's about patient care. It's about their families, businesses, and people's jobs. Leave your cell phone off or in a car. Again, if you're working, that's very different. Now we do a lot of our things on our phone, but if you're observing or volunteering, you don't understand something, you want to take notes or look things up, but you do it at home. Um, I have a old school pen and pad. At work, I carry one of these things with me at all times. I don't know if you could see it, but it's kind of a notepad and a pen, and I take notes. On first couple pages, I have codes for like extension and codes and stuff that I need for the computer, but also use one to take notes of the things that I need to look up. But also with these little devices, cell phones, there is patient privacy. So with recording and taking pictures and things, be very careful. This is something really important. And I've actually put a link in this, a nurse that got fired. I actually know there's like a video about it too. I actually had a colleague of mine lose her job because she took a picture in the ER, not a patient or anything, but just a really bloody trauma, and she got fired. And so and this is a nurse in New York that it happened to. So if you're going into volunteering or working or anything, I know you want to take a picture in your scrubs and post it on your Instagram. Do it at home, do it in the bathroom of the hospital. Don't do it next to the sign of the hospital that you are working at, that you're working there, or that you're wearing scrubs and things. This is like a lot of people have lost their jobs for doing this, and so and I know that you're excited to do that, but don't do it. Um, if you're volunteering, you are a guest. Um, if you're shadowing, you are a guest, and know that. And if you're joining this tribe either through your training or orientation, um, and so in a healthcare team, everyone is important and plays a role. Um, Respecting others. Don't ever make a comment like, "Oh, she's just a nurse." Um, if you're definitely going into medicine, nurses are very important into your success, but also, healthcare team are very tribal, and so if you want to get to the doctors, getting to interact with them, they're the best gatekeepers for them. And people will test you. This is something that when we had volunteers in the ER, I used to do that all the time. I would walk them around and show them, and I would say, "This is your first job. This is a blanket warmer. Um, your job is for the next 4 hours that you're here, the next 6 hours that you're here, stock this blanket warmer." And the people that did it, I would know who they were, and I would make an effort to make them included. So if there's a cool procedure going, I would like let them go in there. If sometimes we're doing ortho procedures and you need to hold a leg or something like that, we would let them do that. But if you didn't do what we asked you to do, we would just forget about you, and that's kind of the reality of how the world works. And another one was, if they passed the blanket test, I had the glove box test, which I would take them and I put a bunch of gloves on a gurney, and I would tell them, go around and fill up all these empty glove boxes. These are things that it's our responsibility and our job to do it, but if somebody else can do it for us, we are very appreciative. So I would and I had a couple of volunteers that were really awesome and showed up and would help you stock. And so there was a really cool case going in the ER. I knew the charge nurse, and I would go up there and say, "Hey, this student wants to go watch this OR case happening." And so, people are willing to go out of their way to get to what you want to get to. And at the end of it, it's not about you. And you're not the center of the universe. And so we get volunteers and people that are either volunteering or shadowing that they want to come off as smart, and they ask questions, and not an appropriate time or place to do that in front of 10 people. We had this one volunteer. I remember when we do rounds before the shift. So when the night shift comes in, the morning shift is going. And so we would all do like a walk around. And this volunteer would walk around with us all the time and ask like very inappropriate questions. It got really old, and that person was asked not to come back. And so, yeah, don't do it. And so, things that you should do right now. These are the things that um, I would say if you really want to do any kind of thing with healthcare, get comfortable shoes. Don't wear brand new shoes if you're shadowing or volunteering or doing any kind of training, because shoes take time to get broken into. Get your paper pad and pen, get your CPR card and first aid. And now because of COVID, you could do it online. And basically you could do all the classwork, and then you go to a facility for 2 hours and get that. And so get your CPR card, and once you become a CPR certified, you can become an instructor and get paid doing it. And you can actually make pretty good money doing that. But make sure you get your American Heart Association BLS for healthcare providers. I kid you not, people will go and get like some sort of like the Red Cross does CPR as well, but it's not accepted in healthcare setting because they don't do the healthcare one through Red Cross in most hospitals and ambulances. And so one of the ways you want to do this, and I've actually put this here, Google, Americans for healthcare providers in your city and your state. And basically, this is how you do it here. Mouth electro spotlight. There you go. Shoot. So basically, this is how you should put it in Google and find it. And I'm going to have a bunch of these throughout this today. So um, I'm just putting in how to do it in Google. And make sure you have all your vaccines. This is not just COVID-19, but there's a host of other vaccines that you need to do that. Most of you that have gone to college have it. Just make sure you have it ready to go so you're not, you know, looking for it. This is something that I want to also say about taking personal inventory. Taking a personal inventory is, ask yourself this: what do I bring to the table and what can I be beneficial? Because most of life is, if you're volunteering, working, you are basically saying, hey, this is what I'm bringing to the table. I'm here to learn something, get benefit from it. So you speak a foreign language. Spanish, if you're in California and most other states, but California, Spanish is like a requirement in healthcare, because not only you need it for your patients and their families, but some of the people that you work with are only Spanish speakers, like housekeeping staff. And in these certain communities, and I'm just using these two as an example, if you're from those communities, if you're Ukrainian and Russian and speak those languages, that's like a huge need in the clinics and healthcare settings. And also in Fremont, you like speaking Urdu or Pashto. And so these are like really important things to understand what community you're in and what those needs are. Computer skills. If you're 18 or 19 years old, you've been born with screens in front of you. Probably out of your womb, mother's womb, you were like typing and texting, and so you're probably better at screens and you working your way around computers than 58-year-olds can. And so you bring in a great wealth of experience to this. Web design, if you know how to do that, that's a great thing. Coding is another one, and social media. Um, I'm in my mid 30s and I have a hard time with social media. So in our organization, I let people that are younger than me that are way better at social media than me. So if, let's say, you volunteer for an organization, hey, I could do your social media thing, they're like, go for it. So these are the things that you should take a personal inventory if you're helping an organization or an entity or volunteering. Sorry, I need to take a. So the community college dilemma. Yes, there's a huge dilemma. There are no student-run clinics. There's not a lot of pre-med opportunities, and so you could just basically throw your hand and say, woe is me, and God, I'm going to be at community college for the next 2 or 3 years, and I'm just going to like not do anything. And that's an error. Um, that's an error to look at this. So you should look at your disadvantages and make them into advantages. Not a lot of pre-med insights or programs. That's true. And this is the thing. Every community college pre-med students that I hear say this and say, "Oh, I'm just going to wait for clinical experience when I transfer." And I mean, you could do that, but that's a really wrong thing to do. There's a lot of competition at transfer schools. So if you're going from a community college where there's probably 30 or 40 pre-meds, 50, maybe 100, the bigger ones. At UC Davis, there's about 5,000. At UCLA, there's about 12,000. And so opportunities are gonna be at those schools, but they're gonna be much, much less because there's gonna be so much competition for it. They're not just waiting for you to get there and say, "Oh, you're a community college transfer, get in front of the line." Matter of fact, there are a lot of other pre-meds that have been there for 2 years that have been wanting to get in student-run clinics, various programs. They have been tried as freshmen that didn't get in, so they get on a committee and they help do PR, fundraising. So they're engaged for 1 to 2 years to being part of that community. And so when their third year comes around, they probably have an insight because the juniors and the seniors have graduated and they're kind of in the front of the line, and you show up as a transfer student. Unfortunately, you're back of the line, and that's just how the world works. um, and when you transfer to a UC or CSU, they want you to go full time and get out and graduate in 2 years. They want you to take at least 16 units. And so you're basically, as a junior, you're taking upper division courses. You are in a new environment that you are not acclaimed to, and you're taking 16 units. I think your first quarter they may let you take 12 units, but they want you to get out of there in 2 years, and you have to jump through a lot of hoops to say an extra quarter or two. And the other part of it too is you have to do both clinical and research 2 years, and also take MCAT and keep your grades up and take these really hard upper division courses. And so this is an extra thing that you're adding to your plate that is a huge dilemma. And so look at community college as a strength. You are in your own community. You know where the things are. You know how things are laid out. You know the facilities, the hospitals. You've either been grown in that community or you have had some time in that. You know the ins and outs of it. You have time. An average community college student spends 3 years to finish their, even more, sometimes more. Community colleges in California train more than any other entity: nurses, EMTs, respiratory therapists, radiology tech, dental hygienists, community health workers. That means that a lot of these programs that I'm going to go over, they're available at your community college for very cheap. You have priority registration because you're taking a lot of classes that you're taking. Some of them are short 3-unit classes that you could take. Many of them are on the weekends. EMT classes are all on the weekends, either Saturdays or Saturdays and Sundays. And so many of them are on weekends. You are engaging in know the facility. You know where those classes are. You're serving your own community, and a lot of you on your application, they're going to say, "Oh, I want to become a doctor so I could serve my community." That question is, so what are you doing your 3 years or 4 years at your community college? You couldn't serve your community at that time. Um, and then again, the other part of it, you're in your own community. You know the hospitals, you know the settings. What happens to a lot of transfer students is they transfer, or even college students, like UCLA, for example, they all want to go volunteer at Ronald Reagan Hospital that it's across the street from the university. Well, you got like 15,000 pre-health students, and the spots are very limited. But let's say you are in Fresno, there's a bunch of hospitals in your area or that don't have a lot of pre-health or pre-med students. Or in like Sonoma County, there's like 3 or 4 major hospitals and only a community college and a very small CSU. So again, there's a lot of these hospitals that in your own communities that you can get involved and engage with. This is something that I'm going to tell you as kind of a warning. There are private training centers, but be careful. They're not all created equal. Do your research. Look at the state and national entities to see if they are listed as training sites. So for example, for EMT, there's a website that you could go there and you could look at if this facility is recognized as a training center, because anybody could set up a training center, and now there's 1,000 of them that are online. And so basically for some of these programs, you're paying the cost is for speed, so you could get done a lot faster. You could do it really fast as 1 week of didactic for many of these course trainings, or you could do it in a 2.5 weeks for like an EMT course, which is like 160 hours. Some cost just way too much, and you just got to be careful. And some trainings, some things that the training is maybe only option that you have. Some community colleges may not offer this, like phlebotomy is one of them. I would say try to stay under 3,000, and I know that's a lot of money, and so um, and so look at, let's say if you take a course for $3,000 and it's 25 bucks an hour starting, that's 100 hours of working. Well, you kind of have to hustle. If you can't afford it, just say, hey, can I volunteer in your front office for a few hours, or comparable, answering phone calls, helping students. Get a group of your friends and get a discount. Say, hey, Mr. and Mrs. Training School, I'm going to bring in a group of 12 pre-meds, and it costs $3,000. If we come in at 12, give us a discount, $500 discount. So that's kind of using your strength as a number. And offer to volunteer, come back as an instructor. And that's kind of a tall, more longer one. But if, let's say, you've been a chemistry tutor for a year and say, hey, I've been a chemistry tutor for a year, and if I become an EMT or phlebotomist, can I come back and teach? And they'll pay you for that. Then, so that's another way you could recoup the cost. But I think volunteering in the front office or getting a group discount, that's probably like one of the best things you could do. COVID-19 challenges. So we have heard over and over again that, yes, COVID-19 has upended healthcare in many ways than one. And yes, there's a lot of uncertainty at the beginning and now, and there's uncertainty that's always changing with Delta and Omicron and many other things. And one of the big reasons, there's a liability issue. If you get COVID-19, who pays for your treatment? And your private insurance may deny you and say, hey, Mr. Pre-Med or Miss Pre-Med, you got COVID in a hospital, and say, we're just not going to pay for it. And what happens if you end up dying from it? Who's liable? As a health worker, you get disability insurance, you get death benefits, you get a host of other things. And there's a lot of stress on health workers. And one of the things, there's a lot of shortage of staff. And that's where you can come in and get a job pretty easily now compared to years ago. And yes, medical schools understand that COVID has upended the pre-med process and shadowing and all these different things, but you get to stand out if you find a way around it. I mean, there's a couple of medical schools that have put out PR stuff and saying, oh, we accept this Joe Schmo medical student, and they were fighting in the front lines, um, doing contact tracing or doing all these various things. I'll go over those things that are available now. So again, you found a ways around it, and again, that shows that your perseverance and knowing a way around to dealing with challenges. So again, volunteering in the ER hospital, that's the conventional way a lot of people have done it in a COVID-free world. Hopefully, maybe COVID ends next month and we could all go back. That's one of the easiest ways to get in. You basically sign up and they put you through a HIPAA orientation and a couple other things. And in a smaller community, be respectful and listen to staff. Again, nurses and staff are gatekeepers. Being perfect at the small things in order to be great at the big things. And again, I use the blanket and glove box test. People will do that. Say, hey, can you keep this up for the next 4 hours? And if you're able to do it, that's great. Overcoming COVID-19 challenges. Since you can't volunteer, then what? Throw your hands in the air and don't care. That's actually an old rap song. Anyways, you could get paid. You could get paid an actually pretty good money. There's a lot of our opportunities, and there's shortage and burnout. There's a lot of people that are just burned out of healthcare and of doing other things. And again, and the needs are really great, and you could use your personal inventory. Again, if you bring in your culture, your language, your skills. Um, it's a really important thing. And the cool thing now is most trainings are now virtual from home. And so you could get some of these training um, at home and basically be trained. This is like a big one. This is like a big one that you should do. There's a great need for contact tracers. Some of them include training. The pay range is 15 to 19. You can become a supervisor, which you can make good money. It can be done remotely and it's very flexible, both the work and the training. This is like something you could do right now. After we're done, it's going to take you a good 7 hours. You could become a certified contact tracer for free. It costs you nothing. You could go to Coursera. It's a John Hopkins School of Public Health training program, and a lot of people have gotten jobs doing this. And if you want to get a job, there's a Google instruction. You basically put contact tracer jobs and the name of the city or the county, or you could do the volunteer part and put the name of the city or county, and you could find it. But again, this is like a very simple thing you could do that addresses one of the major health issues right now in healthcare, which is COVID-19, being a contact tracer. So basically, what does a contact tracer does is basically somebody gets a positive test, somebody's exposed to COVID, and you start basically calling him up. You get a list of people to call, check up on them, and different counties have different roles and jobs. And so again, this is something very simple you could do and be certified, and you get a nice little digital certification. It says you could do it in 7 hours, but I did it like in 4.5 hours. So, um, like I said, if you could take OChem and much difficult classes, you could watch the lectures at time and a half speed and do do well. Um, COVID-19 vaccine and testing sites. There's a great need for volunteers, even if you can't inject it. And so I volunteered at some of the FEMA sites, and there's so I inject, and I basically would show up there for 5 6 hours, and I try to inject as many people as possible. Well, we need people that can translate. We need people that do crowd control. We need somebody to sit in front of the computer, because if I have to do any of those things, it slows me down greatly. So if you are willing to go volunteer and sit in front of a computer and input the data, that's a really great thing to do. And look for the county, state, or FEMA clinics. Private sites like CVS and Kaiser and stuff that have their own employees and you really can't do it, you could contact them via email, or just show up and just say, hey, I want to come and volunteer. What do I need to do? What steps I could do? And each place has a different thing. This is kind of a funny story. Well, not funny story, but I showed up to get my booster and I was going to do it at work and I didn't have time. So I came home and I ended up doing it at my county facility. And so I went up there and, it was a little crowded. So I show up and there is a group of Afghani people that show up, and there's about 20 or 25 of them. And they were sponsored by this local church that was basically, they just came from Afghanistan. None of them spoke English. The person that was with them that spoke English couldn't make it there today. And another volunteer from the church that spoke Dari wasn't able to make it that day. I speak Farsi, which is a very close dialect to Dari. And my Farsi is not like the greatest in the world, but I could get by with it. And Dari and Farsi are very similar, but it's not perfect. So I basically sat there for like 2 hours, and I was just there to get my booster shot, and I was tired, but I was able to translate for them. And come to find out, at this county place, there was a group of doctors that were retired and they were volunteering to inject people. And I was just there, and I ended up talking to a couple of them, and And one of them actually is a retired person and used to be the department chair at UCSF, and I know some people at UCSF, and I'm like, oh yeah, that person who's the chair now used to be one of my students. So I got to interact with them. I told them about myself, and the guy's like, hey, this is my number, an email me or call me. We could grab lunch sometime if there's anything I could do for you. I know a lot of people at UCSF, so this is kind of like, I didn't ask for it, but I also like provided something, and the tool that I had was my ability to speak and help people. And even though I've done a lot of vaccine clinics, I was just there to get my own vaccine, just because I didn't want to wait around at work to do it. So this is just an example of being, malleable and ready, and being able to just help people. And this goes back into translating. If you speak a foreign language and you're proficient at it, not that you've taken Spanish 1 in high school, but actually like understand and know medical terminology. Now, if you are an immigrant or you're kids of immigrant, all of us have to do it for our parents and our grandparents to take them to clinic and other government agencies to translate for them. So you could do it. In California, there's actually a law that you have to have, I think it's like 40 some odd languages on translation. And so AT&T and T and these translation companies, and it's really expensive. So they try to hire staff. But again, it's really hard to hire certain languages. So if you speak a language and you're proficient at it, there's like entities that you can be certified through them, but there's like not a unifying thing. So just basically, contact some of the federally health qualified clinics, hospitals, contact their administrator and say, hey, I want to volunteer. And a lot of times you could get paid for it. And at some community colleges, there's like a certification course that you could take for healthcare interpretation. I think it's like a 3-unit class. If again, you have to be proficient at that language. And so I'm going to turn this over to my colleague, Elizabeth, who's going to talk. She's actually done medical scribing, and I'm going to let her do. And you can, you have the ability to share the screen. So she's going to run through her slide, and then I'll just add a couple of things after her to kind of search for those jobs. Go for it.
Hey guys, yeah, give me 1 second so I can get the PowerPoint ready. Okay. All right. So just a little introduction about me. My name is Elizabeth, and I was born and raised in Queens, New York. I received my Bachelor of Science at St. John's University. And my experience is kind of different from students that are trying to apply to medical school. So for me, my goal is actually PA school, and I'll be attending PA school in the fall at St. John's University. And one of my experiences has been working as a medical scribe. I work as a medical scribe at NYU Orthopedics. So this is our kind of like saying at Scribe America, doctor saves lives and scribes save doctors. If you don't know what a medical scribe is, they document all physician and patient interactions from the start of the visit to the very end. So as scribes, we help the provider with the documentation, and so that way they can focus more on providing patient care. And this also helps the provider become more efficient, because the providers that we work with, they probably went to medical school probably 30, 40 years ago. So as technology advances, and now there's a new system that they use at NYU called Epic, the providers are still becoming more familiar with that. So we're able to help them with that as well. We also provide real-time physician documentation. So we're in the room with the physician and documenting everything that the patient is saying and everything that the provider is saying, rather than after the visit where probably you or the provider won't recall any of the important details. We also relieve the provider of clerical duties. So they spend probably 5 hours of their day just doing charts at the end of their shifts. So that's something that we kind of help them with. Also, to increase the amount of patients that are seen per hour, and also save time per patient during the encounters. We help with that, and decrease the time each patient spends in the facility, like as they're waiting to see the provider. And at Scribe America, there's many specialties that you can be part of, and these is just a few of them listed. So like I mentioned, I work in orthopedics, and I was in emergency medicine for a short amount of time, but it was really, really fast paced for me. So I actually transferred out of that and went to orthopedics. I've been to internal medicine once to cover for someone, and it was completely different than orthopedics. And something also that I wanted to mention is that you can also work as a telescribe. So now that providers are doing virtual visits because of COVID, you can also be part of that as well. And they also now recently, since 2019, they have vet scribes now. So if you know anybody that's interested in going into veterinary school, please feel free to share that. Okay. So scribes, this is just a list of what scribes documents. So first and foremost, it's usually, you start off with the history of present illness. So the reason why the patient is seeing the provider today. It's very different depending on which specialty you're in and how the notes will look like. But usually in the history of present illness, you just write why they're visiting, any symptoms that they're presenting with, any pertinent negatives, past medical history, past surgical history, social history, things like that. And then moving on, also medications, forgot to mention that. And then moving on, you move on to the physical examination. So that's when the provider dictates everything to you. And it's really, really crucial getting all that information down, because even if you ask them afterwards, like if you miss something, the provider won't exactly remember word for word what it is that they said. And usually the physical examinations help determine the diagnosis. So it's really important to at least get 98% of that. And it's also kind of difficult because if you're not familiar with the medical terminology as they're dictating it to you, and you're thinking, what is it that they said? You're also missing important information at the same time. Yeah, so that's something to mention. And while you're documenting that, Scribes also place orders. So in orthopedics, as the provider is dictating all the information to me, I'm also putting in orders for x-rays. And after that, we also have to monitor those imaging results, as well as lab work, depending on the facility that you're working at. And lastly, at the end of the note, they have the plan. So you would include like the diagnosis and the treatments as well. And moving on to the scribe training, it's divided into two parts. So first is the classroom training, which depending on the specialty, there are about 7 to 8 classes that last 2 to 3 hours. And you'll basically learn all the medical terminology, abbreviations, pathophysiology, documentation, coding, and billing. And then at the end, you'll be taking a final exam. If you are able to pass that final exam, then you move on to the floor training. And during the floor training, you'll be working with a more experienced scribe or the chief scribe and the provider. And there are about usually 6 to 8 training sessions, depending on the specialty and the location. And usually you begin off kind of shadowing the experienced scribe, but then after a while, they would want you to do 1 or 2 charts. And then during the next session, you would have to complete at least 40%, and then 60, and then 100. And you'll basically be done with training if they can see that you have the ability to independently work with the provider. Something I should mention though, that the training is really rigorous, and about 40% of people that apply and go through the training don't make it. That's mostly because they don't have the time to study during the classroom training or even the floor training. So that's something that you should keep in mind. And definitely think to yourself if working as a medical scribe is right for you. Right now I'm in my gap year, so I'm able to work full-time. And in my facility, it's a little bit different, like the hours are not consistent. So every week and every month is different. But if you go to school full-time and you're looking to work part-time, they can definitely be very flexible with that. But they do require for you to be committed for at least 2 years. And also the shifts are usually 8 to 12 hours. It also depends on the specialty. So in emergency medicine, some shifts were 4 hours, and some of them were 8, and some of them were 12. I remember for one of the shifts, I didn't get out until midnight, as opposed to orthopedics where the days are always 9 to 5, which is something that I really enjoyed as opposed to emergency medicine. So yeah, you also have to think about the unusual shift times. If you're prepared to work at least night shifts, and then definitely during finals week, it's definitely a lot of long hours and having to be on your feet, and also be prepared to work holidays as well. And typically you work with one provider. Again, it depends on the specialty because in emergency medicine, you actually work with multiple providers and also PAs and NPs. Um, okay. And these are just some things to keep in mind. Being a medical scribe isn't really for everyone. It's a really complicated job. It's there's some requirements that you do need to have, although you don't need specifically any certification or anything like that. It's a lot of critical thinking, multitasking, definitely, and a lot of communication with the provider. Um, so if you do feel like being a medical scribe is right for you and you have all these qualities and traits, then definitely apply. Okay, and something to think about. Wait, let me see. Okay. So as a medical scribe, you're with the provider 24/7. So you'll be able to learn more about what a provider thinks, how they come about their treatment plans and their diagnosis. You'll be able to observe a variety of patients. You'll be able to see different cases as well. Every day, I would say, is something different. Um, and also being a medical scribe can help you become a competitive candidate for medical school or PA school. Um, and even if you don't succeed with the training or if you don't move on, you still get paid for all the training and the time that you worked. It's definitely fun and rewarding. And you do have opportunities for growth in terms of you can, well, something that I did being part of Scribe America was that I was given the ability to give talks to kind of recruit other people to apply and become scribes. And they actually pay you a little bit more for just doing that on top of working as a medical scribe. Okay, so just some pros and cons. So as a medical scribe, you're not physically touching the patient, so it won't be considered patient care hours, rather healthcare hours. Just something to keep in mind. You'll be able to shadow a physician, and depending on the specialty, you'll be able to be surrounded by PAs and NPs as well. It is a fast-paced and stressful environment because you'll be, like I said, you'll be with the provider, but the provider will be seeing about 3 to 4 patients at a time. Usually they see 30 to 4 patients a day. So if you're working in the emergency department and you have a patient coming in for shortness of breath, and then another patient that the ambulance brought in, and then you still have another patient waiting to be seen, you have to do charts for all 3 patients at the same time. So it's definitely really fast paced. Although being a medical scribe, like I mentioned, it will help you become a competitive candidate for graduate programs, because as you can see, it's not really an easy job and the training is rigorous. So if you do make it, then it does make you competitive. And the hourly wage, it ranges from 14 to 15 an hour. at least in New York, it does. I earn 14. And a pro, well, I added a pro and a con. I added working with a provider as both a pro and a con, because it really depends on your preference. When I was working in the emergency department, I really didn't enjoy working with multiple providers, just because they have different preferences in how they do their charts and their notes. And a lot of them, some of them are very fast, some of them are slow, some of them, even with the mass, is just really, really difficult to hear what it is that they're saying. So that can be a con. But like I mentioned, they transferred me to work in orthopedics. So instead of working with multiple providers, I just work with one. And that was actually really easier for me, because I was able to understand his preferences in all of his notes and his charts. And every day it's basically the same thing. And you also have the ability to work in multiple specialties. So, like I mentioned, I was able to pick up a shift in internal medicine, and it was very different in terms of the medical terminology and how the provider likes to have their charts done. But you can at least have like one training session, 1 to 2 training sessions, and it's basically similar. Especially if you're able to keep up and you have like computer abilities and you have a very fast typing rate. And yeah, they're also able to be very flexible with your hours. They understand that you do go to school full time, and you probably have other responsibilities as well. So let me see. I did mention sense of belonging being a con, because, and this is just from my experience, you're sort of invisible to the patient and then sometimes the provider. Depending on the provider that you work with, they will treat you differently. For example, like the provider that I work with, whenever I do something wrong, he just decides to do it himself rather than showing me how I should be doing it. Or small things like whenever I do something wrong, he just decides to address it to me in the room with the patient, as opposed to doing it afterwards. So yeah, it's just like small little things. But I would say that's about it. And the company that I work for is Scribe America. But you can definitely apply to any open positions as a medical scribe in your area. I'm sure there are many that are looking to recruit medical scribes. It can be outpatient care, it can be a hospital, urgent care, even. But yeah, these are just some instructions. And if you have any questions, you can always email them. And if you guys have any specific questions, please feel free to email me.
All right. And if you have questions while Elizabeth is here, you can put it in the Q&A and maybe we'll go through them. All right. I'm going to continue with this. So Yeah, and so I think Elizabeth has a lot more experience. I've dealt with them at the other end of it in the ER as a tech, and I personally think they're underpaid. That's just my feeling, even in California standards. But it is a good way to do that. There's a website that I found is medicalscribes.org, and then if you're looking for the job, just medical scribe in the city or the county, and you could find a host of them. This is another one, a job that you get into the hospital with just this BLS, CPR license, certificate, sorry. Some hospitals call them different things, either patient transport. Orderly is like the old name, lift team, or patient escort. Great jobs to get in to the door, and a lot of big hospitals hire them. First of all, you need to move patients around the hospital to testing like CAT scan, MRI, V2 scan, patient moving from ICU to step down or to the operating room. So these are really great jobs, and big hospitals have a lot of them. Uh, you only need to have your BLS provider license. If you have your EMT or anything else, it helps. Um, and the cool thing is you get to go around the entire hospital and know a lot of people. And if you're a good person that shows up on time when they put you through the system and go the extra mile or help the staff. One of the other things is patients are now much larger than they used to be 50 years ago, so they need multiple people to move them. Now, you need to be in good physical shape. No, you do not need to be a power lifter, and no, you do not need to be a man to do this. I would say in our hospital, about 40% of them are women, and some of them weigh about a quarter of what I weigh, and they could still move 50 pounds. And there's a lot of part-time opportunities for these positions. And the sweetest job is night shift because it's a little bit slower. You also don't have as many supervisors, so like the 11 to 7 a.m. shift is like the best shift to work. And if you're a night owl or somebody like that, so it's a great position. Um, just be careful when you Google this, put patient transport, a city or hospital name. Now, patient transport, sometimes you may get like van transport, and that's not the same position. Lift team or patient escort are the other terms that you could find in Google. Indeed is also another good place to find jobs. Um, and so, yeah, and so this is a really good place to get into the hospital. I know uh, like one or two ER techs that we hired were used to be on the lift team, and so it's a great place to do that. Now, EMTs, that's what I am, and I also teach it, so I'm kind of a little bit biased towards EMTs, but that's just me. I think it's a great stepping stone if you want to go into medicine. You learn great skills like taking patient histories. You know how to identify signs and symptoms of emergency. You know how to stabilize patient. Um, EMTs are taught at almost every single community college in California and also in other states. Um, very cheaply. And also, most of them are on weekends. You need to have a BLS healthcare provider and also an emergency response course to do that, to be able to prereq to get into that class. And I could say that if you can take OChem and bio, then the class, the academic part of it is very easy for you. The challenge is people that are book smart, they don't tend to be very good at the action and dexterity, and that's okay. You learn through that and you learn by doing. You also learn that when you get your first job. So a lot of people get really frustrated because they could read something, but then when they have to put it in action, like taking a patient history and stuff like that, they get very flustered. And one of the interesting thing is now a lot of medical schools now require, not, no, it's supposed to be now, so what they do is they let you come in the summer before your first year. You take an EMT course for 2, 3 weeks, and then they put you out in the field and you work on ambulances, and that's what they're doing um, at a lot of medical school curriculums. I know Hofstra's one, UNLV's another one, and there's a few other ones. Basically, it's a national test, and it's 168 hours. You have 24 hours on the ambulance and 12 hours in the ER. You have to pass the NAEMT, and you get licensed by the state and the county as well. You have to pass a background check and a driving test check. There are other levels of EMT. Now, California, in the urban areas, California usually has a lot of paramedics as well, but EMTB is like the first level. AEMT or advanced EMT is just a one extra course on top of the EMTB course. And paramedic program is actually 8 months full time. And if you're taking a pre-med requirement, it's just very difficult to do that. And you need to have at least a 1 year of full year of EMT experience in an ambulance to become a paramedic. And so I personally don't think that um, if you're taking a full pre-med courses, it's a smart thing to do to become a paramedic. If you're not at a community college or don't want to take the semester long class, UCLA has a great program. It's a little expensive. Project Heartbeat's another one, and like that's one that it's like 2.5 weeks you could do it, and so that's like a really great place to look at. There's hundreds of other ones, and so I would definitely check the NAEMT website that I showed you before. It shows you all the testing centers in every state, and also you could look at your state EMS education and see which schools and programs have the highest pass rate. Some of the private ones have like 40% pass rate, and the one school that I actually teach is at College of Marin, and we have like 100% pass rate, and for the state exam, for the national exam, and so definitely look at, not all schools are created equal. Some of the private ones that charge you $3,000 have like a 40% pass rate. And so what kind of jobs you could do as an EMT? Ambulance, it's actually what the EMT was designed for. You take 911 calls, but as an EMT, you drive because paramedics and firefighters and firefighter paramedics are usually doing the advanced level care. So like if you go to a gunshot wound as an EMT, you drive, but if it's like an inter-facility transfer, the paramedic may drive, and each company does it very differently. Another one is that as a 2 EMT unit, you do a lot of inter-facility transfers. So you'll take one patient from a hospital to a nursing care or vice versa. And then the other one I think is a really good experience is clinical care transport. It's usually with a nurse and a doctor, or a nurse, doctor, and an EMT, or an EMT and a nurse. And that's when you take like patients that are like heart patients and like they need to go to a cath lab or other places. Another one you do is event medicine. So you go to concerts, sports games, and large events. So like I don't know if you guys know, like the Astro World thing. Most major large events have them. Um, Casinos hire them, movie sets, and then the emergency department, which is um, you need to have at least 1 year of EMT experience. You also need to be an a phlebotomy license, and also an EKG certified, 12 lead EKG. And then some places ask you to have a medical terminology class as well. So it just depends. And they want you to have at least 1 year, 2 years of hospital and 2 years of field and 1 year of hospital. So those are a little bit more challenging to find. Other places you could do EMT. RockMed, this is a very special organization to me. I've volunteered with them, and I was on their board for a few years. You basically just need to have a BLS, but if you really want to do stuff, be an EMT. And there's a lot of doctors and PAs and NPs and nurses around, and it's a great learning experience. They've also done a lot of COVID-19 vaccine and testing sites. It's volunteer, but there are also some paid opportunities. And unfortunately, RockMed is in Northern California. So other places, I'm sure there's other entities, and you could just, you know, event medicine, EMT, you could find them. Another one, CrowdRx, is a national one, and they do a lot. They're really big on the East Coast as well, and in Southern California, and also Northern California. So CrowdRx is another one. Um, so this is another one. Phlebotomy is a phlebotomist is a great position. You draw blood in hospitals, labs, or clinics. In California, you need to have 40 hours of class time and 40 hours of lab. Basically, for 40 hours, you go to a lab and you have to do, I think, 60 draws to be signed for. And you could find all the information about how to get licensure in that. It's a really great place to start. One of the jobs you could do is for insurance companies where you have to do pre life insurance and also medical insurances. You get paid $100 to go to somebody's house to draw their blood and label it, and then send them all in with their blood pressure and everything. You get to schedule and travel for yourself. It's also a really great job for your gap year. So if you're planning to take a gap year, and if you want to do clinical research, and some of the clinical research say, oh, well, we need blood draw, and most of the clinical research positions don't have phlebotomist prerequisite, because what they do is, if as a clinical research, if you're not a phlebotomist, you send the person down to the lab. But if you have that, then I think you get hired more. Say, hey, by the way, I'm a phlebotomist and I could do all the blood draws instead of sending the patient into this maze to go to the lab to draw their blood and they get lost, and you could do it. And so if all things equal, that's something that you have. Uh, a lot of community college, not all community colleges offer phlebotomy training. One of the best ones that I found is phlebotomyusa.com. They have them like all over the place across the country. Um, and it's a fast thing you could get done. And then UCLA Center for Pre-Hospital Care, which their website was before, they also do that as well. Another one is a certified nursing assistant, and basically it's for hospice care, elder care, hospitals. Some hospitals hire CNA, private homes. I know a friend of mine who did that, was a private CNA for an individual, and was only working nights, and he was able to study for the MCAT. While this person slept, you just sat in the corner of the room and studied your MCAT. So whole health is another one. Memory care, patients that have Alzheimer's and other things. And as a CNA, you're providing basic care, like, cleaning patients, bathing, turning them, making sure they don't get decubitus, wound care. You help them with eating, vital signs. Um, you don't inject them with anything. That's not something you could do. And in California, actually has the highest requirement in the country, but you need to pass 150 hours, which is a mixture of didactic and direct care, and pass the state exam. And each state has its own nuance. I think like Oregon is like 142 hours, but you got to spend like 8 hours doing certain things. So every state is different. And so I would look at, Google, CNA and the name of your state, because everybody has like a different thing. Some of the pros and cons of it is, it can have very flexible hours. It's a great experience, and it provides an important need that patients have. Now, I'm a little spastic. It's a very slow pace for me, like sitting for 8 hours while somebody's sleeping. I would probably, like, in a few minutes would get up and curl up next to them because I would just fall asleep. Um, and you're taking care of people that are in really bad state, so people that are confused, elderly, and you do some lifting and turning, and a lot of times you're by yourself, so may not be the best situation for you. But again, it provides a need, and I think that you're dealing with people that really need the help. And find if you there's a lot of programs that are at community colleges, but there's also private ones. And again, be really careful because not all of them are created equal. And the state agency for California has a listing of them, and every state has a listing of the training programs and also their pass rates. And outside of California, the Red Cross does a lot of CNA training as well. So um, this is also another one. This is a registered behavioral technician, which basically you're dealing with people that have autism, children or adults that have autism, and it's only a 40-hour training, and it's like $100 to get the training, and you take the exam, and there's also a free program that you could do. But once you become a registered behavioral technician, you do a lot of um, work with autism. Also, you do like kids that have ADHD. Some hospitals use registered behavioral technicians for help the life child specialist, which is like a whole separate thing that I'm not even going to mention because you need to have a bachelor's degree and 600 hours to be certified, and that's like way too crazy. Doula. So one of those things, if you're say, hey, I want to go into women's health and I want to help women be an ABGYN, doula is a really great experience. It's direct patient care. Is basically you're providing emotional support, information to a mother during childbirth and afterwards. You're actually not delivering the patient, but you're providing support to the mother and also to the father. And it's not only for women. I actually have a good friend of mine, and her wife actually hired a male doula because they're like, we need to have a male thinking in that room because we would both. So, so they have doulas as males, so you don't have to be just female. Um, you're not delivering the baby by yourself. You are either there with a midwife or a nurse practitioner or even a doctor that does home delivery. Doulas can be both in home and also at hospital. I know Sutter Health has them, and I know a few other hospitals that have them as well. And some of the private doulas, you could make like $1,000 to $2,000 per birth. You could also work with other doulas and do kind of like a team thing. And some really good doulas are like really booked up and they can't take any more like patients. The certification is about 60 hours, and there's like all the information in every state, county, city. There's also additional certification like postpartum, advanced doula, and also now there's also a geriatric doula, which basically kind of an offensive thing, but anybody that's over 35, they're considered a geriatric pregnancy. So they're doulas that just work with older moms. And it's a great experience. I mean, I had a friend who did that, who was pre-med and did that and now actually doing OBGYN residency. Hospice care. This is another one is you provide support for patients and families. Again, you're not providing direct patient care, but a lot of times you sit there and you provide comfort for the patient or the family. A lot of times they have hospice care, like if there's a CNA or family member, and you just go and watch the patient while the person like cooks or in their home or at a facility or takes a shower. It's a very humbling experience. I think you're dealing with somebody that's at the end the death of their end of their life, and there's a lot of wisdom in that. There's also some people are alone, and you get to be one of the last people to interact with them before they die. And the neat thing about that is the doctors that do hospice care are very good with hospice workers because hospice volunteers or workers. You could also do either volunteer or get paid. Um, the volunteer ones are definitely a lot more and more readily available, but hospice physicians are very good with dealing with people that provide hospice because they are trying to answer as many questions as you can. But again, there is other people there, like a CNA or a nurse. But the challenge with any of these things is that a hospice nurse may have 20 patients and may not be able to be there with that patient, or CNA has 6 to 8 patients to take care of, and they're providing those medical cares. But you're just sitting there. A lot of times you're reading to them, talking to them. Um, just using FaceTime to connect with their families and loved ones. And so, um, and it's a very humbling experience. I could tell you that I've dealt with end of life with a few people in my family, and it's a very humbling experience. Um, Community health workers, this is another one that, again, it differs from state to state. I know California colleges have programs, and the ones that I found was City College San Francisco and Sac City. I think you take 4 or 5 classes, and they're like 2 to 3 units, pretty easy classes. It's a great job. You work for FHQ clinic or a lot of rural clinics that need community health workers. You're not providing direct clinical care, like you're not, you know, drawing blood or doing patient care, but you're providing a lot of patient follow-up. If people have tested positive for certain tests, you also become a case manager, and you work usually under a nurse practitioner, but you may have like 50 patients that you take care of, that you make sure that they go to their mammograms, their prostate exams, their colon exams. And also, if you speak foreign languages, that's like a huge asset to many of these uh, clinics and communities, and you're actually serving your own community in that sense. And so, looking up the community health training by city or county or state, also looking at different requirements by each state. Um, these people, I think, in my book, and I've dealt with them a lot in the ER, sexual assault crisis response, the SART team members or SART team volunteers, I think they're angels on earth. They basically, if somebody's been sexually assaulted, either women, men, or kids, although the kids one, you have to be like, it's like a more like, it's usually a social worker or somebody that's trained to deal with kids that have been sexually assaulted. But but it's a great need for both women and men. About 15% of men do get sexually assaulted. Most of them are volunteered, some of them are paid. You basically are on call, and you get a pager or a cell phone, and you're on call, or just basically activate your cell phone from certain. Just depends. Everywhere is different. You're basically on call, and you get a text, or and you have to go to the ER within. I think you have a 45-minute response time, and you basically go with the patient and you sit with them and you try to provide them comfort, support. Services in your training will tell you all the steps that you could tell somebody to, um, in terms of making sure they're okay. There's police officers there. You're not there by yourself, and usually a nurse or nurse practitioner does the sexual assault exam and with a police officer, and you're not doing any of that stuff. You're not in the chain of custody, but you're just basically there for them, calling their family members, making sure they're okay, making sure they get to a safe house if they need to go to a safe house, making sure that all their meets are met. And then some of them you actually follow up with them. And in California, it's a 68-hour training, and you could do it online now because of COVID. Some smaller counties don't even have sexual assault response teams in certain counties. So you got to go to another county. certainly in a lot of rural counties. So, so in that sense, um, if you're within a county that has a start, so most of the bigger urban places have sexual assault. Usually, like the county hospital or the major medical center has that. And it's a, like I said, if you're telling in your medical school application that you really care about women's health and justice and all these different things, this is something they could say, hey, I spent 2 years doing this. Um, and again, it's a great, and I think people that do this are wonderful people, and I have a lot of respect and adoration for them. This is another one that's very special to me. This is something that I've done over the years, and I wish I could do more of it. But um, basically, you're a court-appointed special advocate, and each county has a chapter. There's also a national organization with the websites there. You basically are advocating for minors to the court system. So a child that goes through the court system, they have all of these, like their lawyer, all of these different people, social worker and everything else, but you are directly working with the child and you basically report to the judge. So if the kid says, hey, my lawyer sucks, or my social worker does this, or if I'm in the foster system or anything like that, you get to meet with the kid, with the child, and you basically report to the judge. And you get very good at listening to what children say. So, like, if you're applying to medical school and say, "Hey, I really care about children. I want to be a pediatrician." Well, what did you do? I spent 2 years doing this, um, and so some of these kids are going through really horrific, challenging times, and you're basically there to make sure they're okay. The training is about 40 to 50 hours. There's also um, on training that you go through that, and different counties have different needs. It's all volunteers, and again, most of the people that do these type of volunteer things are people that are in their 50s, 60s, 70s, are retired, so they may not understand what Instagram is or TikTok is. So you are a lot closer at their age, and you could provide a great service and great impact in somebody's life, because you may only be 10 years older than them. So you understand TikTok or being bullied on social media or all of these different things. And you get to have a very good relationship with the judge. And so when I was in Sacramento County, I worked with this judge for a few years, and now this person's a federal judge, and very good friends with them, and they knew that I kind of wanted to do this in my life, and they're like, hey, if you ever need a letter of recommendation. So if you get a federal judge to write you a letter of recommendation, it says that, hey, you're a nice, compassionate person and you care about people. And so again, this is a really great experience, and this is something that's very close to my heart. Even though it's not direct patient care experience, you are providing a great support for a child. And so again, this is how you would Google CASA or code appointed special advocate in the county, and those people do great. And the training, again, it's also done online, so because of COVID. So this is another one. This is like a really awesome thing to do. I did a little bit of it. I didn't go through all the training, but during the various disasters in Northern California, I've showed up to some of these, and because I'm an EMT and um, I work in the ER and stuff, I've actually helped with some of the shelters. But Red Cross disaster assistance team, you're basically a local or county level. If there's a small disaster, like somebody's house burns down, you get text and you show up, or you get a call or text. You show up to this disaster right after the fire department, and you're basically, these people are displaced. And so, as a disaster action team member, you have these vouchers. You could put people up in hotels, you could give them food vouchers, you could make sure that, and besides like getting cancer or car accident, like somebody getting their house burned down is like one of the major crises in somebody's life. And if you could just do it a little bit better by just making sure they're okay, they have a place to sleep that night or for a few nights, and to have food, get them the basic necessities to do that. It's a really great thing. And again, this is another challenging part is that most of the people in the Red Cross that do this are older people that are retired that have the time and the ability to do this. But again, um, some of the places that get burned down, it's like in the middle of nowhere. And some of these folks have a challenge just to get there, but also like walk on dirt floors, dirt ground, and stuff like that. And again, this is a volunteer thing. So you could be available whenever you can. And this is, you know, you're for people at the lowest point of their life. And so it's usually the training 7 to 8 classes. And if this is another way as a college student, you could use strength in numbers. You could get a group of your friends and say, hey, there is 15 of us or 10 of us that want to become disaster action team. And your training time is Mondays from 8 to 4 or 8 to 2 or whatever. This doesn't work with us, or 8 to 12 or 8 to 10 or whatever. There's a group of us. Can you do it on a Saturday for the next 3 weeks or whatever? And they will gladly do this, and they will bend over backward to get younger people engaged and involved to do that. One of the really cool things is that you become part of the disaster assistant team, which you could go on the national disasters like major disasters and they actually pay you for that. So let's say in the month of July, you're like, hey, I don't have, something to do, or I just 2 weeks I have, you know, between semester or whatever, and there's like a major disaster in Puerto Rico. Well, they will fly you out there for free and they'll actually pay you. And you could do anything from providing resources or becoming like a shelter manager. Um, Actually, what happened to me was I showed up at a shelter and I was like, "Hey, I'm here to volunteer. I'm an EMT. I work in the ER. I have my badge." And that night, the person that was supposed to be the shelter manager got hurt, and they had nobody else coming up. And they're like, "Hey, can you be shelter manager tonight?" I'm like, "What do I have to do?" Be like, "What is like?" Well, this is like they gave me this book, and they're like, "Just make sure that all of these resources are there. Make sure everybody's safe." So I was like, "All right, I could do that." So. Um, and these are the things that I think just a little bit too long, and I just don't recommend. It's a little bit longer to do, but like medical assistance takes 2 years at a community college. You could do it through a private setting, which is like $15,000, and it's just not worth it. The other part of medical assistance, it's a lot of the training is you do direct patient care, but a lot of the training is working in an office, dealing with billing and other things. And so um, again, that's like a really long one. The other one is surgical tech. At a community college is at least a year training, and with a pre-reg takes you another year. Some private entities, schools would do it in about a year, and it's like $20,000. And again, I just don't think that for the time being and the expenses to do that. And then the part of the other one is the 2 week international trip. And this is a personal opinion of mine. I think it's kind of unethical that you can't provide direct patient care in the US, but then you go to a place that's poorer and a little bit browner than us, that you are doing blood pressures and blood draws. And so I just think that's a little unethical for me. And then, if you can't do it here, why is it okay for you to do it in another country? And it's too short. Like in 2 weeks, I'm not sure what kind of clinical training that you're getting or interaction, and then also too much money um, that for you to go, um, to do that. So that's just my personal opinion. The other part of it too is you should never. This is either international or in the U.S. You should never have to pay to get clinical experience or any kind of volunteer and things like that. That's just a personal opinion of mine. Um, and this is a citizenship class, and this is actually another thing that's very special to me. If you speak another language, you teach people how to pass 100 questions. They only take 25, but it's 100 question about civil stuff. And if you basically have taken an American government class in college or in high school, you could basically teach them this thing. It's about understanding the three branches of government, um and to me this is like a very special thing because I've done it both in Farsi and French. And to me, like the most emotional time as an immigrant, that I get to go watch somebody else get sworn in and become citizen, and it's like a very emotional thing for me. Even though it's not clinical experience or anything like that, I think there's a really great need for it. So I know it went a little bit longer than we were supposed to, and I'm sorry. There was a lot of there's a lot of things to go over, and I know some people left. So if there's any questions that I could answer, I answered some of them online already, and there's one question. Um, they're asking about shorter time requirement for scribers. I don't know. I think again, if there is a place that has a great need for scribes, they will take shorter requirement, um, but also I think that um, you don't know if you're going to commit to this for 2 years. So say so I don't know. That's kind of a challenging part. Um, um, but again, if they're going to train you and pay you to get trained, they want something in return. Um, and you read ask, I've completed CMA course. Do we have to take another exam to be able to work in a hospital, or will we be able to go and apply to clinics? So I think CMA, the Certified Medical Assistants, is mostly for clinics because a lot of the training it's done through billing and other things. And so I don't know of any places that they may hire you at like a hospital clinic. So like our hospital that I work at, we have family medicine clinic, which is on the hospital ground, but it is a clinic. It's not inside the hospital. I think the bare minimum to get into a hospital is a CNA to work on the med surg floor and those places. Um, yeah. Any other questions? Anybody else? Anyone? All right, just a huge favor, if you guys could answer the poll question. If we don't have, um, all right, so I guess we don't have any more questions. Um, yes, I am going to post this on the website. Um, I'm gonna try to email it to everybody that attended tonight. I don't know if it will go because it was a pretty big PowerPoint. And so if I can't email it, it'll definitely be posted on our website.